Well, hello everyone, and welcome once again to our CAPE training program. My name is John Leatherman. I'm located at Kansas State University. My partners in this project include Mark Skidmore, Director of the North Central Regional Center for Rural Development, Rosa Solas McKelvey, Communication and Logistics Coordinator at the Center, and Paula Miller, our CAPE Postdoctoral Fellow. And I'd acknowledge that a substantial number of additional people have had input and helped us to create our program here today. CAPE stands for Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. It's a co-production of the Substance Abuse and Mental Health Services Administration, the United States Department of Agriculture, and the USDA Regional Rural Development Centers. The partnership is intended to identify and disseminate more effective response strategies to the challenges of mental illness and substance abuse within our communities. Our CAPE training objectives are twofold. They are first, to enhance behavioral health literacy and reduce the stigma associated with mental health within our communities. And to accomplish that objective, we've all participated in the Mental Health First Aid Training Program, where we've learned about helpful response strategies to mental health issues when we encounter them. To accomplish our second objective, to create and sustain community coalitions to address behavioral health issues within our communities, we've undertaken this training program dealing with the development and implementation of community-scale initiatives that can accomplish our shared objectives and goals. Finally, we'll wrap up our second objective by actually developing an action plan for pursuing a more healthful circumstance within your own community with regard to behavioral health. Here in our training program, we are still talking about engaging the community and building consensus. We will meet together by way of webinar to discuss community strategic action planning. And finally, we'll meet a last time to see what progress has been made within your communities with your strategic action plan. Today, what we'll talk about is sustaining the initiative over the long term. We'll talk about some metrics to measure progress in achieving our community goals and objectives, creating a strategic action plan, and we'll finally wrap up by talking more broadly about community needs assessments. So first of all, talking about sustaining the initiative. It really starts at the beginning. When I go out and I work with the community and we establish our community priorities, we've gone through our planning process, right then and there I ask them for commitments for their ongoing involvement to implement the plans that we've worked hard to create. And so sustaining the initiative really requires creating a detailed action plan that suggests exactly what is going to happen over the near term, the intermediate term, in order to meet our longer term objectives. So before we break from that meeting, I will ask for volunteers who will lead at the initiative to pursue continued efforts targeting a given community priority. I will suggest that they make specific plans before they go about their busy lives to start within 2 weeks to establish exactly when and where they're going to get together to continue their work in pursuit of trying to achieve their stated objectives. Now, in the near term, perhaps 1 to 3 months following the conclusion of our formal meeting, what needs to happen is they need to first of all determine who has to be involved over the longer term. The chances are that not everyone who needs to be involved in a given issue participated in our program. And so we have to first ask ourselves who are the right people who can help us to accomplish our objectives. And those individuals need to be recruited. I'd suggest making it easy for folks to participate. And that might be to meet on some regular basis for a brief time, once a month, once every 2 months, and make it fit people's schedule. perhaps having a working luncheon, or agreeing that a meeting will last no longer than 60 minutes and will begin at 4 p.m. so people can go home at the end of their regular business day. Establish a regular meeting locale that's conducive to doing work. Frequently at the county courthouse, there are meeting rooms that folks can get together at. And I suggest actually reporting to your local governing bodies to let them understand and know exactly what is going on, who's involved, and what you're trying to accomplish. In the intermediate term, perhaps in 3 to 12 months, what I recommend is trying as much as possible to create something of an institutional culture, which is to say, have a leader for the initiative designated. Create agendas for your meetings such that they are more formalized. Record attendance and take some notes of what you're trying to accomplish. Someone needs to take the responsibility to schedule these meetings, to send out the invitations, and to make sure that the appropriate records are being made. I suggest as well to begin by setting some small, discrete goals to start. It's important to have some accomplishment in the near term to keep people motivated and make people feel like they're accomplishing something. Also in the immediate term, find opportunities to have some successes, even if they're relatively small accomplishments. But what you're wanting to do is build a mindset that action is happening and things are getting done. You want to invite people to report on their relevant programs and initiatives that contribute toward the achievement of your goal. Over the long term, perhaps 12 months or more, I recommend making formal reports to governing bodies at least once per year to let them know that there is this ongoing initiative and progress being made. I would suggest having some sort of a formal event where you invite external partners in the broader community to listen about the efforts that are ongoing. Report through the local media the issues that are being dealt with, the efforts that are underway, and the successes that have been achieved. Celebrate success, share credit, and congratulate the initiative for those who have participated in your community endeavor. In terms of measuring progress toward accomplishing our goals, once again, we go back to our original CAPE Community Action Planning, where we ask ourselves a few questions. What needs to change? How will you know the situation has changed? Articulating a long-term goal that needs to be accomplished, and identify the priorities that are essential to achieving that long-term goal. Once again, appropriate metrics to measure our progress, what we can expect to accomplish in the relative short term of perhaps 6 to 12 months. We have perhaps the opportunity and the capacity within that time frame to influence community awareness, knowledge, attitudes, and skills in and around a given issue or challenge. In the intermediate term, perhaps 1 to 3 years, we would expect that we're beginning to influence people's behavior, their actions, decisions having been made, and policies having been adopted. And then in the long term, once again, we would hope that we've been able to change the social, the behavioral, the economic, the environmental issue that was of immediate concern to us at the start. And so once again, we come back to this notion of creating the community action plan. Now, we have suggested as an objective for our CAPE program to create or strengthen and sustain a community coalition to address ongoing behavioral health challenges. But we have also suggested that you can articulate and identify your own objective that is relevant to your community. It may be a specific challenge, or it may be a specific group that you would want to focus on, as opposed to this broader notion of the community coalition to address ongoing behavioral health. Once again, we've created some tools for you. We've provided you with this community action planning worksheet that we're suggesting that you sit down, spend a couple of hours in and around the issue that you're concerned about, and actually fill this out. It will help you to create your action plan. We've also provided you with a sample action plan that I've created to accomplish exactly the goal that we've stated, to create a community coalition to address behavioral health challenges. So finally, with regard to our community action plan, we are going to have a webinar in fairly short order where we're actually going to talk about our respective action plans. You'll share the thinking that you've undertaken in order to accomplish your goals and objectives in relation to behavioral health. And so we invite you now to spend the time necessary, hopefully drawing on some of the ideas that you've been exposed to throughout our training program, to create an action plan. We'll be given perhaps 5 to 6 or 7 minutes to discuss what you have in mind. The entire group can kibitz to try to help you to refine or improve your action plan, but that is kind of the deliverable that we are asking of you for your participation in the program. Finally, I'll just talk for a few moments about the broader notion of community needs assessment. And indeed, if you go to this particular website, this is the Kansas Rural Health Works website, www.krhw.net, you will see work that I've done over the last number of years dealing with community behavioral or community health needs assessments. Now, you will find a series of reports there that look like this, that actually presents a community health needs assessment. And these were mandated by the Affordable Care Act that required certain nonprofit hospitals to engage in a community health needs assessment and perhaps dedicate some effort toward improving health within the communities that they serve. But you can look at these community health needs assessment and substitute the word health for whatever you would care to, whether it's behavioral health, whether it's comprehensive planning, whether it's economic development. The process of the community needs assessment is similar throughout. And if you take a look at the final reports that we've presented, you'll see our meeting schedule where we've essentially done everything that I've been talking about in this entire video series represented in our meeting schedule. In a very discrete and very tight time frame, we've gone through and done virtually everything that I have suggested is part of this process of needs assessment and establishing community priorities and organizing a community to engage in an important issue. You'll see the data analysis, you'll see our group discussion, you'll see our community outreach, you'll see our community survey, focus group discussions, and actually our action planning. And you'll note here, we ultimately end up with a very discrete number, 3 priorities, but you'll see here that everything that people contributed by way of discussion in terms of what they believe were important on behalf of community health is incorporated here. So you can see an example of exactly what I'm talking about by way of building a community consensus in and around an issue. And then finally, you'll see that in each and every one of these programs, we've created a community action plan. Now, I asked people who attended our programs to actually go through this action planning process. Now, these are not educators who are used to the idea of doing this kind of planning. These are hospital representatives, they're public health people, they're community leaders, they're local farmers, and they can sit down, and a lot of these groups did a pretty good job of developing action plans in and around the issues that we identified in our priority. So if they can do it, certainly we can do it as well. So finally, with that, we'll wrap things up. What comes next is in pretty short order. We're going to have a couple of webinars. Our first webinar scheduled will be to discuss this whole community development process and action planning. We'll have an opportunity to answer any questions about what may be expected of you by way of your own action planning. And then very shortly thereafter, we'll have yet another webinar where you'll have an opportunity to present your work and share with the rest of the participants exactly how you intend to utilize the information that you gain through the course of this program. So finally, once again, here is the contact information for myself, Mark Skidmore, Rosa Solis McKelvey. You can contact me by way of telephone or email if you would like to discuss your ideas or if you have questions, comments, reactions. I welcome all of it. So with that, I'll close and I'll look forward to visiting with you by way of our webinar discussions. And otherwise, once again, thank you very much for your attention, your efforts on behalf of this. It's important work that you're doing. And I'll wish you well in your endeavors. Thank you.